Finding out that you have a lung nodule or need lung surgery can be a worrisome time. The multiple tests and waiting period may be very stressful. Understanding the logic and the process may help you get through this difficult time.
The lungs provide oxygen to the blood system and carry away carbon dioxide. They also serve as a filter to harmful air pollutants. Breathing is controlled by the voluntary and involuntary centers in the brain. The rate of breathing is adjusted to prevent accumulation of carbon dioxide in the blood system. With each breath, we inspire approximately around a half liter to 1 liter of air. At rest, we breathe 10 to 20 times per minute. The introduction of harmful toxins in the form of smoking is one of the most self-destructive habits. There are approximately 600 ingredients in cigarettes. At least 69 of these chemicals are known to cause cancer, and many are poisonous. The addictive properties of cigarettes are strong and are best avoided early. Quitting cigarettes is no small task and may be one of the most difficult accomplishments a person achieves in their lifetime. Lung cancers often show up as nodules on X-ray or CAT scans. For persons at risk, hospitals often offer a screening CAT scan, looking for nodules that may represent early lung cancers. Finding cancers early that are small and have not yet spread is important to achieve a cure. Initial tests on a nodule or mass will be tailored by your physician, but generally involves a CAT scan and a PET scan. PET scans involve radioactive labeling of a sugar molecule. Anything that is metabolically active will pick up on the radio marker and light up on the scan. Unfortunately, this also includes areas of infection or inflammation, not just lung cancer. In other words, just because a nodule lights up on a PET scan does not mean it's cancer. If there is activity in the lymph nodes of your chest, your physician may want to sample these either with a camera down your windpipe, a bronchoscopy, or by inserting a small camera through the incision made at the base of your neck, a mediastinoscopy. This will help determine whether or not you have cancer and whether or not it has spread to your lymph nodes. If you do not have cancer in your lymph nodes and you are a good surgical candidate, the next step is to remove the nodule. This can be done by inserting a thoracoscopic camera into your chest and using a stapler to cut out the nodule. This will give your surgeon a definite diagnosis. If the nodule turns out to be a cancer and your lung function permits it, then that entire lobe of the lung should be removed to make sure we get rid of all the cancer cells. If you are not a candidate for surgery, then there are ways to biopsy the nodule, either using a needle through your chest or through your windpipe to get samples of the nodule to determine if it is cancer. Patients with early cancers may be treated with surgical removal alone. Those with large tumors or evidence of spread to lymph nodes found at the time of surgery will need to also be treated with chemotherapy and radiation. If we are able to determine that the tumor has spread to chest lymph nodes or to areas outside the lung prior to surgery, then you should be treated with chemotherapy and radiation first. Whether your nodule is removed with a camera, thoracoscopically, or through an incision on your back, thoracotomy, you will have a drainage tube the size of a finger in between the ribs. This chest tube will drain fluid and air until your lung heals. Once there is minimal fluid and air, the chest tube will be removed at the bedside and you should be able to go home shortly afterwards. On rare occasion, people go home with the chest tube due to prolonged air coming out. Pain management will be an important part of your care after surgery. Unfortunately, the ribs are a very sensitive part of your body. Poor pain control can compromise your coughing and deep breathing, leading to pneumonia. Recovery usually lasts about 2 to 4 days in hospital and about 3 to 4 weeks at home. The most important thing you can do to prolong the quality and length of your life is not to smoke. Please don't be afraid to ask your medical staff questions concerning test results and your treatment plan. Stay healthy and happy.